Hi everyone, this is Banu. Soon after I have posted my status about my recovery, there were so many questions about my recovery process. So just want to share a few best practices, what I have done. Um, just to start with, I got my first symptoms on 21st of April, and it started with only sore throat and leg pain. So I happened to have one aceclofenac and the paracetamol tablet to be in the safer side, but the symptoms were not subsiding. So 23rd I gave the sample, 25th I got diagnosed as positive. So sooner I got a 40% lung infection within 3 days, that is on 27th or 28th onwards. I was literally coughing, a lot of dry cough. I can't take even a deep breath. So it was a pretty bad situation, and I was almost in the borderline. So thankfully, I got this home quarantine package from Columbia Asia Hospital. They have guided me pretty well during this entire recovery process. Of course, clinically they were able to help me, but more than the medicines, what helped me is the overall process of how I took care of my lungs, especially how I managed the cough. So there are three things what you need to do very regularly. One would be the steaming. Make sure you take steam 6 minutes every time you do it. 3 times inhaling with the nose and 3 times inhaling with the mouth. So what it does is it helps in destroying the virus factories in the nose and the throat, and we need to make sure the infection doesn't enter into the lungs. And use a couple of drops of eucalyptus oil when you try to steam, when you try to take the steam. And the second one would be hot water always. Make sure you have hot water all the time. Whatever you have, food, water, anything, whatever you want to have, just make sure you have it hot. And the third one would be, and most importantly, the salt gargling. Every day in the morning, take a glass of hot water, put some salt in it, and gargle till the time you get rid of that phlegm, mucus. It's very tough mucus inside. It is very thick inside, so it's very tough to get it out. But how much ever you can, you make sure you do that, and the rest will be taken care by the medicines itself. So coming to the medicines part of it, I got about 9 days of Fabiflu medication, which is basically an antiviral medication which reduces the viral load and helps in recovering fast. Apart from this antiviral medication, you will be given certain antibiotics, certain supplements for your vitamins, like you have your C vitamin tablets, Zincovitz, etc., etc., which you need to finish the course completely. So, and apart from the medicines or even the steaming part of it, the most important thing and the first thing what you need to do is, what you should not do is to get panic, because throughout the process, one thing what you need to maintain is your oxygen levels. And if you get panic, your translatively your oxygen levels will go down because your pressure will go up. So make sure your oxygen levels are maintained between 95 and 100. The time when it goes down to 94 and 93, that's where you need to have hospital attention. So the way how you need to measure the O2 is by means of a pulse oximeter. You can't just randomly put your finger and measure it. So you need to wait till the number becomes constant. That's your saturation rate. And once you do it, initially you need to take a 6-minute walk. After a 6-minute walk, try using the same oximeter and see if the levels are coming down. If the levels are coming down drastically by 4 points, that's where your O2 is pretty skeptical. So you need to immediately get hold of the doctor and get hospitalized, or at least take the advice of the doctor. So I have been managing my I had been managing my O2 levels since a long time because of my workouts, jogging, etc., etc., and because of which I thankfully recovered from this 40% lung infection. Um, so otherwise, probably even I could have been in a situation where I need to get admitted in the hospital. So, so nothing to get panic about this illness. So what you need to make sure is the time when you get the symptoms, start your steaming, start your gargling, just to make sure just to make sure you destroy all the factories within the nose and the throats. And of course, the medicines will do their part. Somewhere on the 10th day, 7th, 8th, and 9th days, these 3 days are extremely crucial. I'm talking about from the date of symptoms. That's where you get the symptoms to the peak stages. Your fever will go up to 102, 103. Your cough will not stop. You will have some little bit of breathing issues. And the day, and that once the 10th day passes, the next morning, immediately you will you will you'll just feel that relief as a magic. That's what happened to me. So the previous night it was 102 degrees centigrade or 101 point something, and the next day morning I found it to be 98 and I started feeling better. That's where my confidence was back. My O2 levels were trailing between 96 95, and suddenly they came up to 98 99, and that's how I realized that I started recovering. So now I'm in the process of post-COVID stage where I need to do some rehab exercises for getting my lungs fully functional. Even now, I cough a lot when I speak. Thankfully, today it's better. You need to continue the medications because any COVID patients will have a chance of high blood clots, and if those blood clots happen in the vitals, you will have a problem. So doctor will put you in some thinners, and because of the overcoughing, uh, there are high chance of your lungs getting inflamed. So to reduce the inflammations, doctors will put you on steroids. So once the steroids goes into your body, the immune system, your own immune system, will take a hit. So it will take some time for your immune system to get back to normal once the steroids are stopped. So till then, make sure you don't go outside, you don't get infected once again, not only with corona, even any other normal cold or cough infections. That can become very lethal, and that can cause to other complications also. So so just make sure you follow this, and I guess you should be able to come out of COVID. And do not stop your breathing exercises. So start off with your pranayams, all these yogic breathing exercises. That's very very important. And forgot to tell you, whenever your oxygen levels are going down, make sure you do the pronal breathing. Pronal breathing means you are going to keep your you're gonna lie on your stomach, and you're gonna keep one pillow under the stomach, one pillow under the neck, and one pillow under the knees, and you will start breathing. And this will help in improving the oxygen levels. At the same time, this will help in reducing the cough also. This process has really worked miracles for me actually. So make sure you develop this habit of pronal breathing, whether you have corona or don't have corona. Every day do this exercise. It's called pronal breathing, PRONAL, pronal breathing, and you will have a lot of YouTube videos on this. And I guess once you do all of these activities, you should be able to come out of corona pretty successfully. And just follow your doctor. Don't take your self medications, don't go behind the CT scans, etc., unless your doctor prescribes. And yeah, and you need to have a constant blood reporting given to your doctor, because there are 4 parameters which are very very important. They are called inflammation markers, like the CRP levels, your D dimer, and your LDH levels, and there is one more parameter. So there are 4 parameters which are very very important. And the ferritin, the fourth one is the ferritin. So make sure these parameters are maintained well even after the COVID. So and then you should be safe. All right, I hope this video helps in giving you an idea as to how you have to tackle the COVID if you get it. And most importantly, you should not get panic. So have a good day, wear double mask now, and stay safe, and don't even get in touch with anyone in physical. All right, thank you, bye.